Dr. Donley, can you hear me? Okay,
Yes,
we're ready whenever you're ready.
that sounds wonderful.
Okay,
And
you
I
can
will go
go.
back.
Yes,
I will go
screen.
back to
Yes.
my screen here.
Yeah.
I'm quite pleased to continue on. I'm going to shift gears a little bit. The second presentation is redefining the role of today's dental hygienist. It's time to do more than just clean teeth. And I will begin by suggesting to you and reassuring you I am the biggest supporter of dental hygiene on the planet. And that support is based on the understanding that indeed today's dental hygienist plays a pivotal role in patients' health. I love this quote. It's a very famous quote. The most important healthcare provider that you should see on a regular basis if you want to achieve and maintain the highest possible level of wellness is a dental hygienist. I absolutely believe that, and I'm going to make a strong case to support that. Now, one of the reasons that I'm so supportive of this quote is because this quote is actually attributed to me today. While I don't know if it's actually going to become famous or not, I really truly believe this. Dental hygienists play a pivotal role. Here's why. It really all starts with biofilm. Yes, it's biofilm that causes chronic inflammatory periodontal disease. But what we now understand is that that biofilm initiates a local host response. That local host response involves the release of mediators of inflammation. Among those mediators of inflammation are things that break down collagen. So bacteria in the form of a biofilm accumulates on the tooth. If it's left there long enough, if either we don't adequately interrupt it or the patient isn't consistently adequate in interrupting it, the body recognizes that bacteria as foreign. Chemotactic signals are sent out. White blood cells and other inflammatory cells are recruited to this area. In an effort to neutralize the bacteria, those white blood cells dump out a variety of mediators of inflammation. Among them are collagenases, which break down collagen. And the thinking being is that the white blood cells have to physically chew through the connective tissue to get to the bacteria to phagocytize and eliminate the bacteria. Well, the collagen that's destroyed in this host response is what we rely on for structural integrity of the periodontal environment. The bone is mostly collagen, the periodontal ligament is mostly collagen, the root surface to which the periodontal ligament fibers attach is mostly collagen. When periodontal disease is inadequately treated, it's the host response that ultimately leads to destruction of collagen, which reduces the bone loss and leads to pocketing. We understand that that host response is risk factor affected. There are certain people, because of specific risk factors, that react more vociferously to the initiating biofilm. As a result, what we typically have been comfortable with in dentistry is suggesting that biofilm, because of the host response, leads to bone loss and pocketing, the ultimate result being tooth loss. When we make our suggestions to patients, many of us explain to patients that periodontal disease leads to destruction of bone. If you lose too much bone, the teeth get loose, and then you can lose your teeth. In fact, gum disease, we tell our patients, is the leading cause of tooth loss in adults. And we all stop there in our discussion with patients. My suggestion from this point forward is to no longer stop at that point, because what we realize that yes, loss of teeth is possible, but left untreated, the damage could actually get worse. We now understand that in the typical periodontal pocket, when we get destruction of that collagen, we lose the integrity of the lining epithelium. The lining epithelium ulcerates. That's why when you stick the big metal probe in there, if you see bleeding, it correlates with inflammation because we no longer have the protection between the pocket and the blood supply. In this typical periodontal pocket, bacterial byproducts, and the mediators of inflammation that are released in response to that bacteria can find their way through the ulcerated epithelium into the bloodstream and travel wherever the blood goes. There is now overwhelming evidence that the inflammatory response of local origin, the local inflammatory response, spills into the circulation and contributes to the systemic burden of inflammation. That evidence is overwhelming, and it has led, in fact, medicine to be increasingly considering inflammation from the oral cavity as one of the mechanisms that's driving the systemic diseases that are affected by inflammation. Not surprisingly, chronic inflammatory periodontal disease has been associated with cardiovascular disease. I'm currently involved in a research project with cardiologists where we're looking at patients who have had an adverse cardiovascular event, typically a first heart attack. And when they're into the cath lab to get their stents placed, immediately post placement of the stent, I evaluate them for the presence of oral inflammation. And in those patients that have oral inflammation, we're following them for 2 years, and we're very aggressively not only eliminating the inflammation, but making sure we keep it at bay. And then we're determining if the reduction of inflammation reduces their risk of having a second adverse cardiovascular event. We are about 9 months into the study, and already the initial data is extremely promising. There's tremendous debate as to what we can say for sure, whether periodontal disease causes these diseases. I think that misses the point. There's overwhelming evidence that chronic inflammatory periodontal disease contributes to systemic inflammation. We know that systemic inflammation, while it doesn't cause these chronic diseases of aging, it's systemic inflammation that clearly is driving the progression of these diseases, which is why medicine is finally embracing dentistry as being partners in controlling these diseases. My whole contention is, what a magnificent time to be a dental hygienist, because dental hygienists are the only ones that are capable of managing this. I think you have the opportunity, and in fact, I think you have the responsibility to manage patients differently. Oral inflammation contributes to systemic inflammation. Systemic inflammation is what drives the diseases that rob people of the quality and the quantity of life. Now, interestingly enough, we've always known in dentistry the risk factors that affect that host response. And many of us, in fact, all of us, should be addressing these risk factors because of the potential effect that they have on oral inflammation. But if you stop and think about it, a lot of these risk factors for periodontal inflammation are the exact same risk factors for these systemic diseases. If, in fact, we treat our patients not just to clean their teeth, but to determine if they have any of these risk factors and assist in modifying these risk factors, we're not only improving their oral outcomes, we have at least the potential to improve their systemic outcomes. In essence, I guess what I'm saying is chronic inflammatory periodontal disease is not just due to plaque. Rather, the current understanding is that chronic inflammatory periodontal disease is a risk factor affected systemic disease with site-specific presentation. Now, what that means to me practically is that there are certain patients we should be treating differently. There are sites that we should be treating differently, not just so that patients don't clean their teeth. Not just so that patients don't lose their teeth, but rather so that patients improve their overall wellness. I think it's fair to say that when a dental hygienist sees a patient regularly to interrupt etiology and to help the patient manage the associated risk factors, that hygienist is helping the patient achieve a higher degree of wellness. What a noble profession to be a part of, helping patients achieve a higher degree of wellness. But to do that, you have to do things differently. Indeed, I met Ayub when he was a student at Western Kentucky University, and he stood out as one of the most capable students. We formed a fast and furious friendship. He opened my eyes and taught me many, many things about the difference between what happens in America and what happens in places like the great kingdom of Saudi Arabia. Taught me a better way to live, taught me to be a better person, and taught me actually a lot about dentistry. When I ask dental hygienists, what do you do for a living? The majority of them will say to me, well, we clean teeth. That's what people come to us for. That's not what Ayub and I learned. Or we help patients in prevention. We teach people how to care for their teeth. While those things are important, those are only part of the story for today's dental hygienist. The fact of the matter is, oral hygiene instruction, prophylaxis, mouth rinsing, toothbrushing, which toothpaste should I use? Should I floss or use a water pick? All of those things are directed at the etiology above the gum line. There are indeed two very distinct environments in the oral cavity. There's above the gum line, and indeed it's important for patients to care for that, and we play a role in making sure patients are able to care for that. But in addition to brushing, there also is an area below the gum line, and it's that subgingival inflammation. It's what you can't see below the gum line that potentially plays the greatest role in affecting systemic health, because that's where the inflammation is that spills into the bloodstream. There's an uncomfortable truth that we as dental hygienists have to accept. The fact of the matter is, if subgingival oral inflammation exists, even the best oral hygiene in the world is not going to have any effect. Brushing and flossing is not treatment for existing subgingival inflammation, but rather it's part of a strategy to prevent the relapse of inflammation only after that inflammation's been resolved. Most people that have subgingival inflammation don't know about it. There typically are no symptoms. They can't tell themselves. The only way they can tell is if they appoint with a competent dental hygienist who can periodically determine if they have any subgingival inflammation, determine what to do to get that subgingival inflammation to most rapidly resolve, and then be kept at bay, because doing so is going to improve their overall health. I think the most vital role of the dental hygienist is to first determine if a patient has any areas of inflammation. We have to get beyond simply measuring the pocket depth and determining what to do based on how deep it is. In the current, most recent World Workshop in Periodontology, the consensus was periodontal probing depth or attachment levels alone should not be used as evidence of gingival health or disease. They must be considered in conjunction with other important clinical parameters, such as bleeding upon probing and modifying risk factors. Monitoring health or inflammation of the gingival tissues is best documented by the parameters of bleeding upon probing, which is why I suggested earlier, when I'm chairside, when I'm determining what to do, I'm first asking myself, what's the risk profile of the patient? What risk factors do they have? At those sites, is there any evidence of inflammation? Is it going to be possible for the patient to maintain that site? What's the topography of the site? What do I need to do? Maybe in essence, it would be better to suggest, instead of using probing depth as determining when to treat, we use inflammation. Now, probing depth is still important, but probing depth helps us to determine how we're going to treat it. And that's another one of those things where in a quick little soundbite in a webinar, it's sometimes hard to make sense of that. That might be worth pondering later as well. What do we use probing depth for? Probing depth shouldn't be used solely to determine when to treat. We have to use inflammation to determine when to treat, and probing depths help us to determine how we're going to treat it. I think the second step in defining the vital role of today's dental hygienist is to determine, the dental hygienist should determine if patients have any of the risk factors for chronic inflammatory periodontal disease and any of the risk factors for the associated systemic diseases. Our patients that come in that are tobacco users, we all very proudly tell them that tobacco use is a risk factor for periodontal disease. But let's no longer stop there. We now have overwhelming evidence, which I absolutely can share with you, that tobacco users are more likely to develop cardiovascular disease. We know that tobacco users are more likely to develop periodontal disease. We also have overwhelming evidence that periodontal inflammation contributes to the risk of cardiovascular disease. I think, indeed, we have the ability, I think we have the responsibility to tell our tobacco using patients, you're already at risk for heart disease, you're already at risk for gum disease, we tell these patients. If you don't partner with us, and if we don't aggressively keep you inflammation-free above and below the gum line, it's only going to add to your risk of heart disease. Yes, it would be wonderful if you would discontinue tobacco. As we all know, that's more difficult. It's easier said than done, especially if you're going to continue to use tobacco. One of the first places you should stop in your healthcare efforts to maintain the highest level of wellness is with a dental hygienist on a regular basis. Patients that are over their ideal weight are in the same category. They're already at risk for cardiovascular disease. Obesity is now a strong risk factor for periodontal disease. We understand the mechanism by which obesity is linked to increased periodontal disease. We have intervention data that when obesity is reduced, periodontal disease is reduced. We should find a comfortable way to determine if patients are beyond their ideal weight and at least offer them the information that suggests they're already at risk for heart disease and other diseases. They're at increased risk for periodontal disease. They need to partner with a dental hygienist to minimize oral inflammation because of their added risk. For these other categories of patients, we can make similar suggestions. Patients that have diabetes. One of the most common side effects, as we all know, of diabetes is oral inflammation. Patients with diabetes have a more difficult time responding to bacterial challenges. Periodontal disease is on that list. We actually have the ability to help patients with diabetes control their blood sugar. There's overwhelming evidence that eliminating chronic oral inflammation improves patients' blood sugar levels. Blood sugar levels everything to a patient with diabetes. By improving their blood sugar, they reduce their risk of systemic problems. The dental hygienist can and should play a significant role in helping patients manage their blood sugar. We do A1C scores. We have a laboratory grade machine chairside in our practice where we participate with medicine. I will tell you that public health is leaning that way. There's such a tremendous public health cost for patients with diabetes managing their diabetes that indeed there's a push to have dentistry assist. Maybe to say that more plainly, while a stop in the dental office might not be the first stop for a patient with diabetes to control their blood sugar, it sure should be a second. It sure should be the second. Now, we have a specific health history that we put together that in essence educates the patients. This is part of the material you'll be able to access and download. I apologize, I don't have it translated. Perhaps Ayub could do that for me. I do have this available in Spanish. We have a large Spanish population in the US. The way the form is set up is, yes, to give us the information we need, but to also educate patients as to these newer messages and the importance of partnering with us if they're a tobacco user, if they have diabetes. We have other information to reach out to medicine, to partner with medicine. I have specific materials that substantiate the link between oral and overall health. From a cardiology standpoint, I recently published a report in the Canadian Medical Association Journal that outlines what we can say for sure. I oftentimes send this to the medical side when we're dealing with patients who have risk factors for heart disease. If you have any interest in reaching out to medicine, if you need any supporting material, I certainly have the ability to supply you with that, and I would love to do it. We actually can make a difference in patients' overall health by addressing their oral health. And lastly, in the download material, there's a whole bunch of practical practice management stuff. For instance, to make it as easy as possible, where at least in the United States, it's almost inconceivable that a patient would step on a scale. That would provide tremendous embarrassment to a patient to do that. It's different, as you probably know, in Europe. In fact, in Europe, finding out what your body mass index score, which is at least one measurement of your weight category, is not only not frowned upon, many people seek that information out. We're not like that in the States. We're too vain to do that. We put together a form that we can simply hand to patients. You don't even have to mention the word obesity. In the downloadable material, and I'll direct you to that site at the end again, it will take you some time to access the marketing materials, the patient education materials, the forms that we use, the literature. But I would suggest to you, you might be able to find information there that gives you the ability to tell patients that you as a dental hygienist play a vital role in their oral and overall health. The role of the dental hygienist should be to eliminate the etiology, not just the brushing and flossing and teaching the patient's oral hygiene, both above and below the gingival margin. We need to access the etiology. We need to determine when we can treat, when we need to refer. We need to be able to provide therapy, of course, in a safe way that maximizes the resolution of inflammation because of the effect on oral and overall health. I think the dental hygienist can play a role in helping patients modify these common risk factors. Now, to make that as easy as possible, we put together a handout that you'll have access to that provides patients with the well-vetted, most popular information. If, in fact, they're interested in smoking cessation, we direct them to resources that give them the chance to do that. Nutrition and exercise has come into its own and received attention in terms of periodontics. We have decent intervention data where if we do things, specific nutritional modification, we see improvements in response to periodontal etiology. There's a lot more evidence that you might realize. I'm happy to share all of that with you. Where that comes into clinical use is when you can suggest and recommend to your patients that, in fact, if they cut down on the intake of processed sugar, if they boost their intake of antioxidants, if, in fact, they boost their intake of omega-3 fatty acids and reduce their intake of omega-6 fatty acids, we actually can have the potential to improve their immune response. We've tried to make that as easy as possible in the handout material. We give this to patients. And indeed, if you're in that heat of battle where you don't have time to discuss it with patients, you might have the ability to at least educate the patients that are interested based on providing them with this material. Now, I realize that there are differences in culture, there's differences in translation. It may, in fact, be important to look at this from the Saudi perspective. My main message is there's enough evidence to suggest that if, in fact, we not only clean our patients' teeth, but if we determine if they have any risk factors, if we determine that if nutrition, obesity, tobacco use is playing a role, if we at least offer patients the potential to alter those risk factors, we can improve not just their oral health, but their overall health. And then lastly, the thing that I think makes today's dental hygienist vital and to be able to do more than just clean teeth is to do this over the life of a patient. The fact of the matter is patients should no longer come to you just to get their teeth cleaned. I've been on a mission in my continuing education efforts to try and encourage dental hygiene community to stop telling your patients to come to you just to get your teeth cleaned. That's not the most important service that you provide. Start telling your patients that indeed, if they partner with you over their lifespan, if they partner with you, they'll achieve a better level of overall health, because regularly identifying areas of inflammation, regularly removing supragingival and subgingival etiology, modifying risk factors is an important part of overall wellness. The dental hygienist is the only person that has the potential to do that. You see patients on a regular basis. You have the ability to assess their risk profile, to assess the presence of super and subgingival etiology, to modify the risk factors. In doing so, you're helping your patients not just keep your teeth, but improve their overall health. And what a wonderful thing for us to be able to provide to our patients. Unfortunately, I have never been able to visit the Kingdom of Saudi Arabia. It is one of my dreams, and perhaps when the COVID pandemic has ceased and air travel opens up, I can only imagine the beauty of the kingdom. I would be overjoyed to come there. I will tell all of you that if in fact I ever make it there, I will have with me, whether I have to smuggle it in or not, t-shirts for all of you. I think it's time for the Saudi Dental Hygiene Society to make sure everybody realizes that Saudi dental hygienists, no, they don't just clean teeth. They don't just teach oral hygiene. They save lives. You have the ability to save your patients' lives. I will look forward to handing these out personally to you. I indeed will end with where I started. I'm tremendously honored to be part of the first Saudi Dental Hygiene Society meeting. What a great effort that's been put forth for the most important healthcare providers today, which are dental hygienists. I applaud all of you. I thank you for your attention. The next time somebody asks you what business you're in, please make sure they realize, no, you're no longer in the tooth cleaning business. That's not the most important thing you do. You're not even just there to help them save their teeth. You're really in the inflammation reduction business. What dental hygienists do is help patients achieve a functional and an aesthetic dentition that can be maintained inflammation-free, because doing so has the chance to keep it that if you get patients the tools that maximize the chance that they're inflammation-free and keep it that way, because doing so is an important component of overall wellness. And as I said, what a wonderful job description. Fulfill your vital role of dental hygiene. Now, I will tell you that indeed, I'm great thankful for Ayub. I had the great pleasure of him not only educating me, but sharing in the growth of his wonderful family. His youngest daughter, who I now know is 18 years old, which I can hardly believe, was at this age when she was here in Bowling Green. She absolutely captivated my family. I feel like she, in some regards, is one of my grandchildren. I miss her and everything that she brought to our family as well. It's funny how time changes. This was my son at the time. If you look at my son today, he has grown, as has my family, the same as Ayub's family has. I look at this. This is a picture of my son recently getting married. He married a beautiful young lady from Ecuador in South America. And I look at those changes and realize how fast time goes by. Please resist wasting your time on the fear and the anxiety that's posed by today. Resist the temptation for dentistry to consider you as non-essential. Stop the lack of collaboration between dentists and hygienists. Together, we actually can make a difference in patients' oral and overall health. And I hope today has made it a little bit easier for you to do that. Thank you so much.
Thank you, Dr. Donley. Really on behalf of everyone and all the attendees, I would like really to express our appreciation for sharing with us this wealth of information. And really, I hope to see you one day here in Saudi Arabia. I think we have two questions from the audience. Dr. Donley?
Yes, okay, and I can see those now, so I might repeat them if that's okay.
Yes, please.
May I ask how long you've been using the health history forms that you mentioned? We started at least 12 years ago. We started taking a wellness approach 12 years ago. The health history form has gone through numerous revisions. What will be able to download is the most current version. We continue to update that as information comes forth. I will tell you that patients are receptive to this. My patient population has changed, and I'll give you a very quick example. I had a patient recently come in who comes to see me from a different state, and it was on a Friday at 4 o'clock in the afternoon, and I was anxious to kind of get out of work. And I said to the patient, as I evaluate, I said, well, there's one area where there's some inflammation. The pocketing is a little bit deeper than we would like it to be, but it hasn't really changed that much since the last visit. We'll see how it looks next time, and if we need to treat it, we'll treat it. And the patient interrupted me and said, well, if there's inflammation there, I want the inflammation eliminated now. And I laughed at myself, because here I am training patients to realize that the goal is to achieve minimum inflammation, and I had forgotten that myself. That's a thing that I think patients can relate to and resonate. The next question was, how did you partner with medical professionals to get patients? How do you partner with medical professionals to get patients the help they need? I started first with diabetes. There are specific letters that we send out. I put that as part of the download material, which is our outreach to medicine. And we send specific letters to patients, to physicians that are caring for patients with diabetes, that say to them, we can help you. I have put together presentations. I go into the medical arena and give them presentations on the relationship. I doing the studies with the cardiologists. I have all of those presentations. I would be overjoyed if any of you individually want to use any of that material. I'd be happy to share that with you.
Okay, thank you very much, Dr. Donley. I would like also to remind everyone of the survey on the top. So, Dr. Donley, really thank you very much, and I wish you a good night.
Thank you so much to all of you. This has been just a wonderful, wonderful experience.
Thank you very much. Goodbye, Dr. Tim.
Bye-bye.